Welcome to Cool Springs Plastic Surgery. Thanks for joining us today to talk about drains. I'm Dr. Konrad Sarosiek and I'm joined here by Nurse Jasmine from our clinic. And we're going to take a few minutes of your time today to discuss proper care and maintenance of surgical post-operative drains. So come on back to the clinic with us and let's take a look. Welcome back and thanks for joining us today. So this is a typical Jackson Pratt drain. It consists of a bulb here, a valve, as well as tubing that then runs and is inserted into the patient. These drains are commonly used after procedures such as abdominoplasties, breast procedures, brachioplasties, and even thigh lifts. The drains themselves function by removing fluid from a confined space. And the way these drains work is this portion here is inserted under the tissue. This is done by your surgeon before you wake up from surgery. This part here, this tubing, is the part that you will see outside of your body and is connected directly to this bulb. The drain works with suction by squeezing the bulb together and using this little plug to close this valve on top of the drain. When you let go, the drain will maintain suction by exerting a negative pressure on the contents of this hose. This will allow the drain to withdraw fluid from the abdominal wall, from your breasts, from your thighs, or from your arms. The drains themselves function all on their own. There's nothing else that you need to do to them other than empty the drain periodically. Very frequently in plastic surgery, we'll ask our patients to empty the drains twice a day, once in the morning and once at night. The drain output is very important for the surgeon to note. We make decisions whether or not the drain will remain in place or the drain will be removed based on the quantity of fluid that is coming out of that drain every day. It's very simple to measure how much fluid is coming out of the drain, and we're going to demonstrate that here for you. So here I have a drain. It has some fluid at the bottom of it. The color doesn't matter what the color or consistency is at this time, but Jasmine's going to show us here how to measure the amount of fluid in the drain. So Jasmine, I'll take the tubing from you and you can demonstrate how to do this.
So what we're gonna do, we're gonna pop the top. It's on the top of the drain bulb. And just pop it off.
It's like a little valve.
And then you'll notice that the bulb will expand. And so then you'll just get this measuring cup that we give you and you dump the contents into the cup.
And then the very important part is you have to look at the cup and determine how much fluid is coming out of the drain. The cups are graduated, they have a scale on the side of them, and that scale is very important. By looking at where the fluid level is, once placing the cup on a level surface, you'll be able to determine the quantity of that aspirate that's coming out of the drain. That number, the next important step is to write that number down on this piece of paper. Patients are really good, and most patients will take this little paper that we give them here post-operatively and they'll hang it up on their refrigerator at home, and every day they'll meticulously mark down exactly how much fluid is coming out in the morning and at night. But the most important part of all of this is that you bring that paper with you to your post-operative appointment. That way your doctor can see exactly how much fluid is coming out and make a good decision about removing the drain or leaving it in place for you. Okay, so we've covered that topic. Jasmine, let's talk about something else next. How do we strip these drains? A lot of times you'll hear the term, were you stripping your drain at home? It's a pretty complicated procedure, so we're gonna show our viewers how to do that precisely. So come on over here with us and let's demonstrate on Jasmine. All right, so what we have here is Jasmine, our clinic nurse, is helping us demonstrate the proper positioning of this drain. So Jasmine, we're going to pretend here, has a drain coming out of her abdomen, and the tubing is located right here, and here is the bulb that is used to produce suction. So stripping of the drain is incredibly important. Drains build up a lot of fluid and debris, and that debris can clog a drain. And stripping allows us to move the contents of that tubing along and into the bulb to help evacuate the tube and to allow the drain to continue its function. The best way to do stripping is what I've found to be my technique, and I'm going to show you here today. What I do is my left hand, I take my left hand and I grab the drain right where it is coming out of the patient. So right at their skin, right at their abdomen, near the breast, near the thigh, near the arm. You grab the drain and you pinch it very hard with your index and your thumb finger. You then take your hand and rest your hand on that person's abdomen or whatever area of the body you're working on. That way it provides stability for your hand, and your hand will not move if it's resting on the patient. You then tell the patient very calmly that this might be a little bit uncomfortable. However, it's an incredibly important part of drain maintenance and care. You next take your other hand, your right hand or left hand, depending on which hand you are, and you take your index and your thumb and you put them right next to your left hand index and thumb. And your left hand throughout this procedure should not move. Your right hand is going to do all the moving. So again, to recap, I am pinching the tube between my index and my thumb. My hand is resting on Jasmine's abdomen. My right hand is the one that's going to be doing all the work. So I take my index and my thumb, I put it around the tube, I pinch the tube, and while holding my left hand steady, I slide my fingers along the tube toward me. So I'm stretching the tube, I'm pinching it, it's collapsed, and I'm just pulling it towards me. But whatever I do, I am not letting go of my left hand at all. Once I've reached the end point of the stretchability of the tube, I then bring my right hand closer, maintaining a very firm pinch, to my left hand. I let go with my left, keeping my right hand still pinched, and then I re-grab again with my left hand right where my right hand is. I pinch the tube really hard, and then I put my hand again against Jasmine's abdomen. I take my right hand again, and the same process. I just keep pulling, stripping, or milking the drain fluid through the tube toward the drain. So again, I've reached the maximum here. I'm gonna let go with my left hand, take my right hand, I'm still pinching the tube, bring it close to my left. Again, re-pinch with my left, and then advance with my right hand. And you just keep doing that until you get to the bulb. And you see, as I keep doing this, I'm getting closer and closer to the bulb, and eventually I'm going to get right up to the bulb here. Here we are. Almost there. Almost there. And we're there. Once you reach this point, it's safe to let go of the tube and the drain altogether. This will allow the tube to regain its suction power and again maintain flow of fluid out of the abdomen and into the drain. So that's the technique that I use. Maybe your surgeon or your staff in your operating room will show you a very different technique. I found that this works best. And again, the most important part of all of this, I believe, is to using that left hand when you pinch the tubing between your index and your thumb, to take your hand and put it against the patient's body. That way it provides stability and you're not pulling on the tube. Remember, these drains are sewn into the patient's skin. With the drains sewn into the patient's skin, any manipulation, tugging, or pulling will inevitably result in pain and discomfort for the patient. So be careful when doing this, follow proper technique, and if you have any questions, be sure to call and reach out to your nurse. All right, well, thank you guys so much for joining us and watching our little video about drains. We thought maybe we would do a little interactive session, and Jasmine, our clinic nurse, can kind of help us out and tell us some commonly asked questions about drains, and we hope these answers might help you in managing these drains at home. So Jasmine, take it away.
Well, first off, Dr. Sarosiek, can I shower with drains?
So that's a great question. There are a lot of different methods of thought regarding showering with drains. Some surgeons do allow patients to shower with drains. Personally, I do not, but it is very surgeon dependent. So before you take a shower with your drain, reach out to the clinic office and ask them, what does your surgeon prefer for you regarding drain showering?
Okay, well, should I clean the drain or irrigate the bulb?
So another very commonly asked question. The drains themselves will fill with fluid, and that fluid can be pink, red, it can be bloody, it can be full of debris. The most important part of it is that the fluid inside and the inside chamber not really lose sterility, which means we don't want you to washing this out with any fluid or putting anything into the drain. allow the drain bulb to merely act as an evacuator of fluid. Don't irrigate it, don't wash it, don't soak it in your dishwasher. There's no reason to put this through a shower. Just leave it alone and let the bulb continue to express fluid, and don't worry about what it looks like on the inside.
Okay. So what if the bulb loses suction?
So it's not uncommon for you to have issues with drains regarding suction and its ability to maintain suction. If you find that every time you compress the bulb and you let go, the bulb does this, where it expands automatically on its own, that usually means that the bulb has lost suction. And the reason why that would occur would usually be to either the tubing that is supposed to be in the patient has slightly backed out of the patient and the drain is no longer functioning, or there is a problem with the integrity of the tube that is resting outside of the patient, meaning that there's a hole somewhere that's allowing air to escape. If that occurs, Jasmine, I would strongly urge the patient to come back in and be seen by their surgeon, because a non-functioning drain in a patient is merely a nidus for a potential infection. So I would advise the patient to come in and be seen by the doctor.
Okay.
And then leaking around the drain sites.
Oh, perfect.
So very frequently, patients will have a drain coming out of their abdomen and they'll notice that their clothing around that area is stained with fluid. It's not uncommon to have fluid leaking around the drain site wherever the drain exits the patient. We always ask patients to keep a layer of gauze around the actual exit of the drain site, and for the first post-operative week or two, be careful, don't wear your favorite outfit. Obviously, getting your clothes stained with this fluid, the stains might not come out, but it is normal to have. It is normal to have some drainage around the drain. Now, if you find that you're getting leakage around the drain and the drain is not maintaining suction, that's a problem. And that's something that needs to be addressed by your surgeon. And I would urge those patients to come back in and be seen.
Perfect.
Okay, do we think we've covered everything?
I think we have.
I do too. This is a lot of information. Feel free to watch this video multiple times and try to take it all in. But we hope this has been a little bit of a glimpse into proper care and maintenance of drains, Jackson Pratt drains, that are very commonly used after abdominal, breast, brachioplasties, and thigh lift procedures. We hope you have a great day. Come back and see us for the next video.